Hi, everyone, and welcome to this edition of 5 Questions With. Today, we're joined by Dr. Bill Powderly, who is a Washington University infectious disease specialist and the director of the Institute of Public Health. And Bill's going to talk to us today about COVID-19 investigational drugs and clinical trials. So, Bill, welcome. As we continue to hear in the news about the importance of finding COVID-19 treatment drugs, are there any drugs that are looking promising?
Well, you probably heard about remdesivir, which is an antiviral that has just been studied by the NIH, and the preliminary results suggest that it has activity against this virus. I don't think it's a home run, but we're probably at first base, so it's a good start. It's been approved now under an FDA protocol to be used for people who are hospitalized. We have a supply of it at Barnes Hospital currently, and we're hoping to be able to have it widely available in BJC very shortly. The other promising area is using plasma from people who have recovered as treatment for people who are sick, and we're using that in the intensive care units to try and see if it would be beneficial. Too early to say yet, but it's certainly something that we have available.
How are BJC and Washington University working together to host clinical trials, and what have we learned so far?
So what we've been trying to do is get access to investigational drugs, and as we get access to those investigational drugs, try to make them available not just here at the Washington University Medical Center and Barnes Jewish Hospital, but further across the system. So we've set up now an opportunity for patients who are in Christian hospital to be able to be enrolled in clinical trials. We've just put that in place. We haven't actually enrolled anybody yet, but our plan will be that as we get access to more and more investigational drugs, we'll have them widely available across the system for people in St. Louis. And there are a lot of drugs coming along the pipeline. This whole process, it doesn't get switched on overnight, but quite a number of drugs that have been tested for other diseases are now starting to be tested for COVID, and I think this is something that we're going to need to have in place for the foreseeable future.
So there's lots of speculation about when a vaccine will be available. Can you share what all's involved in producing and approving a vaccine?
Well, a vaccine is what we all need for this virus, just like we do for other viral infections. And what a vaccine is to try and reproduce what you would get naturally, some form of long-term immunity. So first of all, we have to make sure that we actually can get that with this virus infection, and we're not 100% sure of that yet. But generally what vaccines are is some sort of an activated protein or an activated product that looks like to the immune system like the virus does, and it produces antibodies or other immune responses. So we're starting that process, but it's typically producing a vaccine takes years. What we're hoping is that we can accelerate that with this particular virus. And if we're lucky, we may be able to have a vaccine that looks very promising by the fall or certainly by the spring of next year. But that is only the start of it. We then have to produce it, we have to distribute it, and if you think about this as a worldwide pandemic, we have to produce 8 billion doses of this vaccine ultimately.
So what have you learned personally from a public health perspective as a result of this pandemic?
I think one of the striking issues has been the old-fashioned public health issues, that the best control of this is to increase people's understanding of how it's spread, to try and isolate people when they're infectious, to find people they've been in contact with and keep them in isolation so they don't infect other people. And we're learning things we didn't talk a lot about, things like social distancing, which we wouldn't have talked about 6 months ago, has become a really important concept, as has the concept of masking. And I think as people understand masking, it becomes more and more important. My mask protects you, your mask protects me. And if we can get more and more people to understand that, then I think we actually will have an opportunity to decrease the transmission of this virus.
Bill, my fifth and final question for you today is, what's the most important thing you want team members to know?
I think the real important thing is that that we're in this as a community, and we will beat this virus as a community. We will work together both by protecting one another, by protecting our families, and protecting our patients, and we will win.
Bill, thank you so much for your time today, and thanks to everyone for watching. We'll see you on the next edition of 5 Questions With.